I felt like I did everything right, and I tried to be a conscientious and intelligent consumer of the entire service.
When Mike Fryer went to Rockwall Presbyterian last year with a case of appendicitis, he said he felt secure. He knew the hospital was on his insurance plan, as was the surgeon who removed his appendix.
And this is the statement from Cigna.
But insurance did not cover everything. He learned that a few weeks later when a medical bill arrived for nearly $1,000. That's because one of the doctors consulted in his case was not in Fryer's network and wanted him to pay up.
What I came out with was, it was frustrating that there is no right way. There is no navigating. There's just not a right way to go about getting sick and then getting billed for it.
Currently, if the balance bill patients get stuck with is below $1,000, they're on their own. Over that, in most cases, doctors and insurers will negotiate a deal if patients request mediation. Starting September 1st, that threshold will be lowered to $500, thanks to Senate Bill 481. Consumer advocates like the AARP say the new law will lead to more compromise and save patients money. Others are less hopeful.
The doctors will continue to work the system and bill them $4.99.
Bill Hammond is president and CEO of the Texas Association of Business. His organization supports reforms to minimize healthcare costs for employers and employees and hopes to do away with balance billing altogether next session.
We think that for those who have insurance, the insurance company should be able to go to bat and negotiate a rate for the entire difference between the contracted rate and what the doctors are billing them for.
Doctors groups fear that eliminating balance billing will hurt their practices. They say they'd have to spend more time in mediation with insurers and less time with patients.
No, here it is.
Fryer ultimately paid the roughly $700 balance owed to the doctor and said he learned a valuable lesson sharing his story with lawmakers.
It gives me pride to be able to tell my friends and family that next time you go to the emergency room, maybe you'll get less of a sticker shock.
In Grapevine, this is Alana Rocha reporting for the Texas Tribune.